Recording in progress.
Well, I'm very excited for today's topic. Hey, office change. So I'm currently in Tampa, Florida. I'm visiting my family. I'm originally from here. It was really interesting because I was looking around for people who I could speak to that have worked as a psychologist or speech therapist or anything of the sort, people who worked with students on the spectrum, ADHD. And I was looking online and people weren't getting back. And then I realized my mom, she actually gave me really good recommendations. We have a family friend we met a long time ago, super sweet, known her for a while, and she's such a great advocate, I think, for students on the spectrum or just with learning differences, and really meets them with compassion and care and understanding. So let's get ready to listen to Michelle Collins. Yeah, thank you so much for your time.
You're very welcome.
Expertise, because I know you've been doing this for a long time, and because I was trying to think of someone, I was like, let me see if I can think of somebody I know. And I was like, let me ask my mom, because I know she's well connected.
She's been in the schools, yeah.
And then she said, oh, I ran into Michelle the other day. I was like, Michelle? I was like, wait a second, I could talk to her.
Yeah, well, I'm happy to help. It's exciting, and I'm happy to hear more about what you're doing and everything. So that's really very, very cool. I am a school psychologist for Hillsborough County Schools. This is my 22nd year. The primary role of my job is doing testing for special education, looking to see if a student has a learning disability, has an intellectual disability, meaning that they have cognitive delays. We do look at children on the spectrum, all the way up through gifted, behavior concerns, everything in between. In between all of that, or even prior to that, I'm kind of like an educational consultant, basically, observing students, meeting with the teachers, meeting with the parents to put interventions into place, because we always want to put interventions into place before labeling a student. So, before saying that they specifically have a learning disability or they need a different curriculum or they need a separate class setting or anything like that, we want to try to help them, in the gen ed setting. Yeah. So it's a lot, and no 2 days are ever alike.
Oh, I bet. Yeah, no, I bet it's so different. There's so much going on. Like you mentioned that you've helped lots of students with so many, I guess, different learning disabilities, and then that you have interventions. So what does that look like whenever you, I guess, take in a student and then you understand what their learning disability is, and then you provide an intervention?
The process, we call it response to intervention. It would involve an observation, usually from myself and other professionals. We would, look at their history. So kind of comb through their records to see, look for any kind of clues as far as, medical diagnoses, other things that are going on with them, and kind of go back to those foundational skills and sort of see where that breakdown occurs. And then what do we need to put into place to sort of help remediate that concern? And then we would collect data, based on that intervention. We would come up with how are we going to monitor their progress? When will we meet back? And we're going to look for a certain amount of growth to, we call it, close that achievement gap. The thing that I think that we're missing a little bit is some of those non-traditional types of interventions. That's why I was really very fascinated with what you had to say about music as medicine. Even for some of the kids that have behavior problems, that may be on the spectrum, that may have ADHD, they're needing a lot of things besides just those academic interventions. A lot of times they need to have some of that sensory input, or maybe it's too much sensory input that they're getting, so they need a little break. They need to be away from the noise and the fluorescent lights and things like that. But this is what they need to help them learn. This is what their brain needs. We're looking at for specific learning disability and academic concerns. We always kind of want to tease out, what's kind of coming before that. Are there behavior concerns because they're struggling academically, or are they struggling academically because behaviorally it's difficult for them to attend? So that's a little bit less conventional, but I always like for my team to kind of look at the whole child. So not just the one size fits all academic intervention, but what else is going on with that child holistically.
Yeah, I really like the holistic approach, the non-traditional, because it's not just like what can we do academically. Like we have to look at other stimulus that like can really impact how they learn and how they respond. Do you typically not only talk to like teachers, but do you also talk with like their parents and like how they can best succeed at home?
Yes, I always meet with the parents as well. I have suggested a lot, like I mentioned, the extracurricular activities too. And a lot of times parents don't really consider that. They're like, but they're struggling academically. Yes, but they may need more of an outlet to kind of help to stimulate that brain. It's kind of a whole team approach where we're talking with the teachers. We have like reading coaches on staff and math coaches, people that are specialized in that particular field. Speech language therapists, occupational therapists are district level, and of course the parents. So we just try to involve, as many professionals with as many different areas of expertise as possible.
It takes a village, I'm sure, to do all that.
Absolutely.
What advice would you give to teachers then, like whether a music teacher or just an educational professional where they do have a child in their classroom or studio who may be on the spectrum or has ADHD, maybe some kind of learning difference?
First piece of advice is just to ask them, what have they noticed? How do you handle that? When you see this, what is it that you do, or what have you found that works? I always try to help them to understand what they see at home is vastly different than often what we see in whatever setting. Sometimes we see this perfect little angel and they can't control their kid for anything, and they're like, they did what? And you're saying they're great and they're amazing. Like, I don't see that kid. Back to your question about like, what do teachers say? I first just ask them to ask, what do you see? And then to kind of say, well, this is what I noticed.
I'm guessing you've had like pushback from parents where you're like, oh, like your child's on the spectrum, let's say, and like we want to help them in X, Y, and Z, and the parents are like, my child is not on the spectrum, or like they might
Yes.
back. How do you mediate those relationships?
Typically they're already frustrated, but they don't want to go to that extent of, a label, or that there's truly something wrong. Or sometimes you have like one parent's on board, but the other parent is not on board. When I do my evaluations, because I'm a school psychologist, so we look at educational eligibility. So it's technically not a diagnosis. So sometimes that helps a little bit to say, I'm not giving them a diagnosis, but what we're looking at is we're trying to find like the umbrella that best sort of describes what's happening with your child. We're seeing these things that sort of look like they would be falling within the autism spectrum, and that seems to be a better way to describe what's happening with your child. And of course, we want them to get the best services, and as they move on through the years, we want anyone who's reading this education plan to have a better understanding of who they are. It's difficult to just come in as this like overbearing professional, I know more than you do and I'm telling you exactly what you need to do. You have to make it more of like a partnership of, we're in this together and we're going to help him to succeed. And that definitely seems to help a lot more. With ADHD, whether or not they're medicated, it often impacts memory and cognitive efficiencies. I've seen students that once they're medicated and we do like testing to look at those specific areas, process testing it's called, the scores improve. It's not a fix, but it definitely makes a big difference. ADHD is often a precursor for ASD, for autism spectrum disorder, which it kind of is a part of ASD. You often see kind of that hyperactivity. So a lot of times a student or a child will be diagnosed with ADHD first. There isn't like an autism cure or an autism pill. It's really just sort of treating the symptoms of what's happening with the person that has autism.
I'm really interested in that. I've never understood like how the two are like intertwined, because I know the autism spectrum is so like I mean, it's so vast.
It
Like,
is it is
multidimensional.
huge. Yes, they just call it a spectrum now. There's this saying kind of that says if you've met one person with autism, you've met one person with autism. Because although, some of the characteristics are very, very similar, they can be manifest, in vastly different ways. The ADHD type symptoms often come along with autism. There's also like the OCD kind of symptoms, they're obsessing over certain things. There can be a lot of anxiety. Early on in my career, oftentimes children with autism were given a label of behavioral disability. There's a lot of those repetitive patterns of behavior. So that's kind of a hallmark characteristic where I'm expecting for things to be exactly the same every day. Or when I come into my environment, I'm going to do this and then this and then this and then this. Well, when things wouldn't go as planned and there was no sort of outlet or anyone to help, these children to understand, they would just react and maybe react in a very negative way. Looking back, I'm like, that kid was on the spectrum. They're not able to communicate. Not only are they not able to communicate their concerns, but they're not understanding the nuances, that we sort of understand. So there's a lot of those behaviors that are seen as even like, oh, they're ADHD because they're all over the place, especially when they're younger. A lot of practitioners don't want to say ASD. And then it might be, oh, well, they're suffering from anxiety. They have a lot of anxiety. That's why they're freaking out. And then they're kind of starting to put all these pieces together. And then it's like, oh, yeah, maybe it is the spectrum. That often occurs more of kids that say are a little more typical. For other children that have a lot of the very classical characteristics at an early age, they may be self-stimming, they have limited language, they don't have the eye contact, some of those telltale signs, they may get diagnosed earlier. But for the people who are more typical, which we're seeing more and more of these days, you do have those precursor diagnoses.
I learned a term recently. It's called masking.
Mm-hmm.
I was watching a video, but they were talking about how like a while ago, like they were diagnosing like a lot of boys, but it was harder to diagnose girls because they were like masking more. I thought that was really interesting.
Right, because they learn sort of the expectation. So we sort of learn to, do the appropriate things, even though inside they're sort of dying, But then as the demands become greater, it isn't always easy to mask, and it comes out in other ways, whether it be the anxiety, the depression, when they're in a safe environment too. You see that a lot. Emotional breakdowns, or, we're kind of all over the place because you've sort of held in all of those feelings and behaviors because you know that you need to be appropriate. So yeah, that definitely does happen.
I know, I was learning about that and I was like, I had no idea. And I was like, it makes sense having to keep it inside to like have a face, but like, inside you're like, So
right. And then it's kind of interesting too, because then the struggle becomes getting that appropriate diagnosis. I always recommend that if there are concerns with ASD, that they look first neurologically, just to kind of rule out any sort of medical concerns or issues, because sometimes that differential diagnosis can be very difficult. You appear so typical.
Yeah, that makes
sense.
Wow, yeah, I know. It like blew my mind when I was learning about that, and I'm sure like so many people have gotten like misdiagnosed or just never even got diagnosed until maybe they're older and they start realizing they're like, oh, like I fit these characteristics.
And sometimes even when their children are being diagnosed, then they're kind of like, oh, wait a minute, that kind of sounds like me. Or, I have some of those traits as well. The research does show that there's a genetic component. So
yeah.
I'm actually working with a little boy at my school now that really would not speak at all. I mean, he has language, he's language impaired, but he would choose not to speak because he would get very overwhelmed. He would just like leave his classroom. Like he would just freak out over something, whether like it got too loud or whatever it was, he would just run. So we really worked on him coming straight to my room. My room was like right down the hallway. So we kind of set up a little plan, and he still wouldn't even speak.
Oh.
He would like point to things, like, he's bright enough where he would find things around my room to point to. Then he would kind of start talking like through a closed mouth, and it took a lot of time. Maybe it was just a couple of months ago that he actually would start speaking, and then people at the school are like, he speaks? Our principal would have a lot of snacks in his office, and he would say to me like this, or he'd go hungry, and I'm like, hi, hungry, I don't understand. What do you want? At first, it would be like he'd stand outside the door, and he'd be like, can I have that? He has very poor eye contact, but I would kind of like have him stand in front of him, and I coaxed him all along the way to say like, can I have a snack? Now he'll go in and he'll be like, kind of looking like this, but he'll say, can I have a snack? And he'll say, yes, of course you can. And then I would say, okay, now wait a minute, what do you say when someone gives you something? And he would like say thank you as he was running out the door. And we're like, wow, he's come so far, which, I mean, it seems like that's nothing, but it's huge. He would just run away, and we couldn't even understand what happened, to now getting him to actually speak and ask for things. And now he'll be like, hi, so-and-so, hi, so-and-so, just on his own. So it's pretty cool. It's pretty exciting.
That is really exciting. To other people it may seem small, but like to you and like to us, it's big. Like just teaching piano, just like some of the small wins. Like I have a student, and it might be like the smallest thing that my other students like, they'll get it in a day or two, but the student, it might take him weeks or months to get. And when he gets it, I'm like cheering him on. I'm like,
yeah. Doing the happy dance and everything. Exactly. Kind of am interested in your program as well, because it would be kind of cool moving forward, maybe to do some sort of club with music and see how that might help some of the kids.
That would be so cool. Yeah, if you ever have any questions about like the music aspect, I will be more than happy to,
absolutely. That would be amazing. That would be amazing.
Thank you so much. It was so nice seeing you.
You're welcome. It was nice chatting with you. Bye-bye.
Bye.